I saw a headline in Third Sector magazine yesterday, Big Society will have a go, but what is it? And underneath the headline was the results of a survey which showed that 60% of people in the voluntary sector and local government think that the government's big society is a good thing, but 65% of them didn't have an understanding of what it was. I'm not great on Venn diagrams, but it suggests that there are some disjunctures there, and I suspect that if you ask people working in the health service, you'd probably get a similar sort of response. And I think it's why events like this are so critical, and why we need to collectively make an attempt to shift those numbers, because the big society is not going to go away. When the Prime Minister talked about it in his conference speech, the amount of time he gave to it in his conference speech was evidence that it wasn't a pre-election gimmick. And in fact, the fact that the government has stuck with the big society narrative, despite the fact that during the election it didn't sell that well on the doorstep, I think is evidence of the extent to which, as a narrative and as an approach, it's going to remain in place, and it's going to define some significant parts of the government's direction across the whole public services going forward. So it's important we spend some time talking about what it is, but I think I'd like to start first about maybe talking a little bit about what it's not. Maybe first I'd like to say that what I'm going to give you is ResPublica's take on the big society, not Minister's takes. Now, ResPublica has a deep interest in the way that communities, government and the economy works, and a lot of our analysis we feel we would share with government, particularly around the big society agenda. But it isn't necessarily coherent and consistent in every way with where all parts of government are or are going at this time. I think, secondly, if you were to bring a minister to this platform, you'd probably find that they'd be hard-pressed to define in absolute and finite terms what the big society was, because the big society is as much a vision and a work in progress as a fully finished product and policy description. And I think if you look at different policy areas, you'll see that progress is pretty varied. And I think I'd argue, and as we'll probably find out later from other contributors, on the health side, I think we're at a very, very early stage indeed. Thirdly, and this is critical, and I think Lynn is going to talk a little about this, the big society is not about outsourcing public services to civil society organisations or indeed others. There are loads of good reasons for doing this around plurality of supply, around competition and value for money, and because services are often better delivered by organisations based close to beneficiaries. And the outsourcing of public services to civil society organisations can undoubtedly help contribute to achieving big society objectives, but it's not a principal driver of the vision. And I think critically on a day like today, it's not about short-term changes in public spending. Although the big society has been launched against a background of a crisis in our public finances, and it may over time help us collectively to adjust in changes in the role and reach of the state. In thinking about the big society, I'd advise you to look less at short to medium-term spending decisions, including those announced today, and rather towards longer-term shifts in the way that government and communities organise themselves, which, given the ambition of the big society project, is a generational thing rather than a 3 to 4 year policy proposal or white paper. And in that sense, and I guess it's my final knot, the big society can't therefore be seen as a conventional government programme with a budget attached, a defined time frame and a clear set of targets against which progress can be tested and checked and performance measured. So it's profoundly different from anything that many of us in the public services have come across before, and I think that's a challenge, particularly in sectors like health, which have been defined by grand but very, very detailed and defined visions rather than grand and limitless ambitions. But I think that means that we do need to think about what it is. And I'd argue that it's as much an analysis as a programme. What underpins it is a deep and I think genuine concern that over many years the strength of links between us as individuals, within communities, within neighbourhoods, have been weakened by a political and an economic system that sought to monopolise power and responsibility and crowded out space that's previously occupied by, I guess, what's currently called civil society. So as the size and areas of competence of the state has grown, we've collectively looked increasingly to the state for solutions, be it through legislation, regulation or funding, at the expense of generating solutions for ourselves. And for many, rather than being participants in economic activity, we've instead become passive workers and consumers, with both those who employ us, those who manufacture what we buy, those who lend us money to buy it, located remotely without genuine ties to the communities and localities that we live within. And this has collectively contributed to a weakening of both personal responsibility and community strength, and has contributed to a society that's increasingly atomised and fragmented. And I think that's something that government, and particularly the Prime Minister, genuinely feels that we need to engage with if we're going to face the challenges of the coming decades. And that atomisation and fragmentation of society in itself has direct and indirect health impacts, because poverty, loneliness and isolation are all major factors affecting physical and mental health. And we know that networks and connectedness, the strength of family and community ties, can have major positive health impacts, as well as providing sources of support when we need it. And given the likely pressures we're all going to face around an ageing population, changing demographics over the next 20 years, I think this is something that we've got to critically engage with. So what does it mean in terms of policy response? Well, I think it's worth reiterating again that the Big Society isn't a closed programme, rather it's an open-ended approach, which is about considering how government, community and economy interact, and looking over time to change expectations and change the ways we work together to move progressively towards a vision of a society that's characterised by stronger links between individuals and communities, with higher levels of social capital and a more equal relationship between individuals, economy and state. And I think in practice that means we need to look towards designing interventions that build social capital from the outset, that build community confidence and capacity, and look to use those interventions to build the quality of and strength of neighbour-to-neighbour relationships, the ability to self-organise on the basis of altruistic exchange of resources, skills and time. And it's as much about that as it is about formalised charities or volunteering, although they have an important role to play. And while some early initiatives around the Big Society have been about things around, for example, sharing responsibility for the public realm and the securing of community assets, in fact, the greater prize is one around greater shared responsibility for one another and the wider community. And in many ways, the myriad of civil society groups engaged in the health sector are a prime example of where this works. So we need to look to create, alongside that, new types of economic activity that are participative and promote a greater distribution of economic power and influence. And that's why mutual ownership and cooperatives are seen as so important by the government. If we're going to remodel our economy, we need to look at how we can lever the size of the state to help contribute to growing those new models of social and economic activity and spreading ownership. And given its size, that's why government's looking to the NHS to provide a lead in this. It's why there's so much interest across government in central Surrey Health, and why there's so much interest in the progress and development of the wider right to request, and in fact why it's so good that Ali's here today to talk about what Circle can teach us there. And I think we'll need over time to accept that devolvement of power and responsibility to communities will have to mean also an acceptance of difference, of disaggregation and localisation. And in some instances, it'll mean, in a world that's become accustomed to scandals around postcode lotteries and brought up to expect uniformity, and health is particularly, one that's vulnerable to that, there will need to be, we won't be facing a straightforward challenge. And I'd argue that on the health reforms in the White Paper, there's still little evidence that there's a willingness to engage with that challenge. I think we also need to look at the relative size of the institutions that deliver. If we're going to ensure engagement of individuals as negotiants rather than as applicants or supplicants when it comes to accessing public services, then we need to address the disparity in size and power between service provider and service recipient. And one of the reasons for the long-term emotional commitment of people in the UK to GPs is because of the notion still closely held of small-scale and local embeddedment. And that compares well to many other remote or services that are perceived as remote and delivered at a distance. So what does that mean in terms of public health reforms, health service reforms, specifically those in the White Paper? Well, as I've said, I think the jury's still out. While there are aspects of the Big Society embedded in the White Paper, in fact it's mentioned in paragraph 1.1, once you get into the White Paper, I think what concerns me is that many aspects of the agenda still seem to be defined in terms of a dialogue between bureaucrats and professionals, where the representation of the big society is more about the makeup of local authority supervisory boards rather than genuine community engagement. And there seems to me to be a gap in terms of the way in which we genuinely engage with communities around health choices, the balance between acute services, prevention, the engagement of sources of social capital as a means of addressing the prevention agenda. Now, some of that may be picked up in the Public Health White Paper in due course, but I think there is a real challenge around health service reform, perhaps because it's such a big and complex area, that we still seem to be embedded in a world where we're looking at changes to the established order rather than embracing the radical vision change that the big society holds out in front of us. I'm going to stop here because you could dive into almost every aspect of the white paper and explore why that's the case, but I'm sure that's for the next seminar, indeed the next speaker. Thanks very much.